Well, good afternoon, everyone. I want to start by making sure that everyone is aware of the disappointing decision that came down from the nation's highest court yesterday, allowing the Trump administration to end the 2020 census 2 weeks early. In the words of dissenting Justice Sonia Sotomayor, the harms caused by rushing this year's census count are irreparable. In normal times, the census is a monumental undertaking, and the pandemic has brought countless new challenges. The consequences of this decision will reverberate for at least the next 10 years. So to every Illinoisan who is watching and listening, here's what you can do. The new census count ends tomorrow. The time to fill it out, if you haven't already, is right now. The time to encourage your friends and neighbors to get counted is right now. Pick up your phone and go to my2020census.gov or call 1-844-330-2020. It takes less than 10 minutes. Make your voice heard by getting counted. And now for today's COVID-19 update briefing. I'll kick us off with a little good news. Illinois is now averaging more than 60,000 tests a day for the last 7 days, meaning we test more than 3 times as much as the average state in the United States. And the vast majority of test results are being returned within an actionable period of time. Unfortunately, all 11 regions have seen an increase in positivity compared to where we were at last week's update. Statewide, our positivity rate has grown by more than 1 full percentage point in the last week alone. And in most regions, COVID-like hospital admissions have increased in the same period of time. To date, Illinois has had relative success in keeping this virus at bay, and we're still doing better than many of our neighbors, but we can't let up. And these numbers are indicating a concerning direction. That's particularly true in Region 5, Southern Illinois, which surpassed 8% positivity on average, up from 5.8% just 2 weeks ago. Today, the rolling average there is down to 7.7%, but it gets back up above 8 and stays there. If it does, Region 5 will face stricter mitigations across the board. I want to reiterate the message that IDPH and I have repeatedly given to local health departments and to local officials. Pay close attention to your community's metrics and have the courage to take action when the local data indicates a problem. I have one simple thing to say to everyone in areas with rising positivity: mask up. It will make a tremendous difference in keeping infections down. Currently, we have one region sitting above IDPH's 8% threshold for resurgence mitigations, meaning the state has stepped in to reduce community spread. That's Region 1, home to Rockford, Dixon, and Galena, and it entered tightened mitigations on Saturday, October 3rd, and has continued to see positivity rates climb at a consistent pace, now up to a rolling average of 10.1%. Hospital admissions in the area have stabilized after 2 weeks straight of growth. To the residents of Region 1, we're rooting for you. Each of you have a direct role in making a change to bring your numbers down. Region 4 and Region 7 have demonstrated that it is possible to bring down that positivity rate with the tools that we know work, and they're within your power. Wear a mask. Keep some physical distance, and encourage those who flout public health guidance to act with consideration for the entire community. With that in mind, I want to take a moment today to discuss the imminent holiday season. Preparations for Halloween and Dia de los Muertos have already begun. Diwali starts 1 month from now, and before you know it, it'll be Thanksgiving, Hanukkah, Christmas, Kwanzaa, and New Year's. It's a flurry of some of the biggest traditional family gatherings in a multitude of cultures, by and large representing one of the busiest travel times of the year. Family gatherings, celebratory vacations, travel, all phrases that have taken on a new meaning and a new sense of concern in a way we never expected a year ago. But just as was true for Easter and Eid and the 4th of July, this virus doesn't make exceptions for traditions. Yesterday, the CDC director reiterated a concern that epidemiologists have been expressing for weeks now. Small family gatherings are one of the most prevalent ways that the virus is being transmitted. He expressed his concern, the director did, so that families will take special precautions as they make Thanksgiving plans. There is no free pass in this season of giving when it comes to COVID-19. When confronted with decisions about the upcoming holiday season, many people who have erred on the side of caution up to now might face new temptation to let their guard down. Well, let me be blunt. This virus isn't taking a holiday. It only wants to find new hosts. And if you think it's okay to let your guard down because some people seem fine after they got COVID-19, I'll remind you that many young people in their 20s and 30s and 40s are experiencing long hauler symptoms of this virus: pulmonary issues, months-long breathing and coughing issues, exhaustion. Even for healthy young people, that's not a walk in the park, so don't treat it like one. The safest thing you can do simply is to take precautions. Dr. Ezike and I want to be with our family during this holiday season too. To see and spend time with our loved ones whom we've spent the better part of a year worrying about. So today, IDPH is releasing guidance and recommendations from medical experts on how to have Thanksgiving and other holidays safely. The recommendations cover subjects like travel considerations, overnight guests, holiday shopping, and celebratory meals. I've asked Dr. Ezike to outline some of that guidance for you today. So, ladies and gentlemen, Dr. Ezike.
Thank you, Governor. So, as the Governor mentioned, planning for our fall and winter holiday celebrations this year will take a little bit of extra creativity and extra precautions, but definitely advanced planning. The safest way to celebrate with the members of your household is to connect with people outside of your household virtually. But I know, we all know, that many people will be gathering and getting together with family and friends. So I'd like to provide some tips on how we can do that a little bit more safely. First of all, if you're traveling, if you have to get to the location, think about how you will travel. Whether you're traveling by plane, recognize that there are lines in security in the airport terminals and try to observe the 6 feet of distance. Remember that there may not be the potential to have the 6 feet of distance on the plane. Traveling on buses, traveling on trains, that can also involve sitting within 6 feet of others for any length of time. Traveling by car might mean that you have to make stops for gas, for food, bathroom breaks. All of these forms of travel can be made safer if you use your mask and continue to wash your hands. So now if you're actually hosting a holiday gathering, try to have as many activities outdoors as the weather will permit. Limit the number of people. Be reasonable when you're thinking of the planning in terms of how many people you can safely accommodate. Remember to increase air circulation indoors by opening windows as much as possible. Remember, if people are coming to your home from out of town, or you yourself will be going out of town, try to see if you can limit your exposures in the preceding 2 weeks. The fewer exposures people have, the lower the likelihood of catching the infection. When it comes to shopping, whether it's for food, for that special host gift, whether it's other kinds of gifts, consider going to stores at off-peak times that won't be as crowded. Or better yet, don't forget the option to order online. or call your local store and then drive up and pick it up. Browse websites for local stores to shop for gifts. Again, when you're planning that special meal, think about the seating arrangement. First of all, you're thinking about how many people you can safely arrange in your home, and see if you can keep members of the same household together and separate other households. You could even try using smaller tables, or even spread out the celebration over multiple rooms in the house. When serving food, think about how that will be done, whether it'll be buffet style. You might want to remind everyone, if it's going to be buffet style, that the utensils that are now being shared, that everyone wash their hands before eating. Otherwise, think of having the food already plated and given to your guests. Try to limit the number of people that might go into a smaller area, like into the kitchen. We all want to be around our family and friends during the holidays, but if you are sick, please understand that you need to stay home. Don't assume that your symptoms are not serious. Don't assume that they aren't COVID. Don't assume that you're not contagious. Take the better decision, and if you are sick, please stay home. We don't want to have our holidays marred by tragedy on the back end. We want to stop this spread of COVID. Since yesterday, 2,862 new cases were identified and 49 additional lives lost. In Illinois, a total of 327,605 cases have been reported to IDPH, and now 9,074 deaths as our total. 1,974 people were reported in the hospital overnight with COVID-19. Of those, 390 were in the ICU and 153 were on ventilators. In the last 24 hours, 52,669 lab tests were reported, for a total of 6,463,923 total tests. Starting tomorrow, IDPH will begin reporting on our website both molecular and antigen tests, both of which are diagnostic tests to diagnose COVID-19. Neither of these are the antibody tests, which represent previous infection. Antibody tests are not going to be included in the count and have not been included in any previous counts. Until now, the numbers you see every day, like today's reporting of 52,669, has only reflected the molecular tests. Antigen tests thus far have comprised less than 1% of all tests performed to date. But with more rapid antigen tests being deployed to the states from the federal government and other sources, and an updated national case definition that says a person that tests positive with an antigen test counts as a probable case, we will see the number of antigen tests increase. Also, another adjustment, we are going to be redoing how we calculate data for Region 6, East Central Illinois, to more accurately represent the spread across the region. Champaign County and its data will continue to be included in Region 6. What will be removed is the University of Illinois Urbana-Champaign saliva testing. That will be broken out separately. This will allow us to better identify testing needs and trends in that region. And finally, as always, wash up, back up, i.e. maintain your distance, mask up, and sleeve up as a reminder to get your flu shot. Thank you.